Today, we're diving to something incredibly common, something, well, many breastfeeding parents experience.
Yeah.
That uncomfortable feeling of a sore, tender breast.
Yeah. Or maybe noticing a change in color on the skin, or feeling a distinct hard spot or lump.
It's a situation that can definitely cause worry, can it? And the immediate question that often comes to mind is this mastitis?
Absolutely. But our mission today is to understand these challenges, from that first tender spot, maybe through potential progression, even complications.
As interconnected stages.
Exactly. Not as separate, isolated issues, but as deeply interconnected stages of the body's natural response to inflammation.
Okay.
Yes. Once you understand that underlying process, everything else kind of falls into place. We'll unpack what's actually happening inside the breast.
What strategies are recommended?
And we'll highlight which older approaches are no longer considered helpful and maybe even harmful, and explain why.
Okay, it all starts with inflammation.
Inflammation.
When most of us think about inflammation, we probably picture, I don't know, a twisted ankle swelling up, something like that. It's often linked with direct injury.
Right, but inflammation is more fundamental than that. It's your body trying to protect itself, isolate a problem, and kickstart the repair process.
Okay, so how does that apply inside the breast?
Well, if we think about the delicate structures within the breast, particularly that network of milk ducts, picture these not as like rigid pipes.
More like tiny, soft tubes.
Exactly. And they're quite easily compressed or narrowed.
And the thing the body sees as a threat, could it be just pressure?
It often is. When there's more milk accumulating in the breast than is being efficiently removed, maybe you're pumping on top of nursing, or your baby's feeding pattern changes suddenly.
Like they start sleeping longer.
Precisely. That extra volume of milk creates internal pressure within those delicate ducts and the surrounding tissue.
And the body doesn't like that pressure.
Well, your body is incredibly sensitive to these changes. It interprets that sustained or excessive pressure as a signal that something's potentially wrong, a threat to the tissue. And bam, it triggers the inflammatory response.
Like an internal alarm bell.
That's a good way to put it. The body sends in its first responders, inflammatory cells, to the area. They arrive to investigate, protect the tissue from potential damage, maybe fight off any bacteria looking for an opportunity.
Okay, but here's the part that seems a bit counterintuitive. The body's own response, the swelling, can actually make it worse.
Yes, the very swelling caused by this rush of inflammatory cells and fluid can actually worsen the original problem. That swelling puts external pressure back onto those already delicate, pressure-filled ducts.
So it becomes a cycle. The initial pressure causes inflammation and swelling.
Right.
And that swelling then adds more pressure onto the ducts, making it even harder for milk to flow freely.
You've got it. That restriction in flow is what people often feel as a blockage or a clog.
So it might not be a literal lump of like hardened milk stuck inside the duct itself.
Often it's more about the duct being compressed from the outside by that surrounding swollen, inflamed tissue.
This inflammation and swelling, that's what causes the symptoms we feel or see.
Exactly. The skin over the affected area might show visible changes. It could look darker than usual or maybe redder or pinker. But it's really important to highlight this. In darker skin tones, redness might not be visible at all. Or it might appear more brownish, grayish, maybe even purplish. So the visual cue isn't always that classic textbook red.
That's a really vital point for self-monitoring. You might not see redness, but the area could still feel warm to the touch.
Correct. The warmth is another classic sign of that increased blood flow, part of the inflammatory activity. The body's sending resources. And this brings us to the progression aspect. If this initial state of inflammation isn't addressed,
Can get worse.
it can intensify. Yeah, the compression on the ducts can become more severe, and this whole environment, this inflamed, static environment, becomes more susceptible to bacteria multiplying and causing an actual infection.
Okay, so that leads us from general inflammation towards mastitis.
Exactly. Recognizing this progression means that what we used to maybe label as separate issues like blocked ducts or plugged ducts or clogs,
We now see them differently.
we now understand them as the earliest stage of this whole inflammatory process.
Stage 1, early inflammation. Triggered by that pressure from fullness. So that tender spot, that vague feeling of a lump or fullness.
That's it. It occurs anytime the breast becomes overly full, initiating that pressure. Then the inflammation follows. The swelling, remember, narrows the ducts, slows down the flow, and that's what feels like a blockage. It's inflammation causing a flow issue.
Right. And what typically causes breasts to become overly full, it usually boils down to a mismatch between how much milk is being made and how much is being removed, even if it's temporary.
Yes, absolutely. It can happen for several really common reasons. Longer stretches between feeds than usual. Maybe you're separated from your baby for work.
Or ironically, something positive, like your baby starts sleeping through the night,
Yeah.
finally, but your body hasn't quite caught up and adjusted the supply down yet.
Exactly. That overnight fullness can be a trigger. Another common one is when your baby isn't feeling well. Maybe they're teething or have a stuffy nose, just generally out of sorts.
So they nurse less often, or maybe not as effectively.
Right. For a day or two, the supply stays high, but the demand drops. That mismatch creates fullness.
Or sometimes it's related to pumping, like trying to pump a lot after every feed to build a big freezer stash.
That can definitely contribute. Pushing your body to make significantly more milk than the baby removes daily can lead to that chronic fullness and pressure.
So in all these scenarios, the result is the same. Too much milk staying in the breast, leading to pressure, triggering that inflammatory alarm.
And this is where it's absolutely crucial to remember. At this initial stage, with those first signs, the tenderness, maybe slight skin changes, this is primarily an inflammatory issue. It's generally not an infection yet.
And the whole approach to managing it needs to focus on reducing that inflammation and supporting natural, comfortable milk flow.
Exactly. Not trying to force something out or immediately reaching for antibiotics.
Okay, so what are the recommended strategies for this stage 1?
First, and this sounds simple, but can be so hard for new parents, treat yourself like you are sick and need to rest.
Rest. Foundational.
Your body is actively dealing with a physiological process. It needs energy and downtime to recover. Prioritize caring for yourself, your breast, and your baby above everything else if you can.
Okay, rest first. Then what's the direct intervention for the inflammation itself?
Cold. Apply cold or ice packs to the tender or swollen area. This is perhaps the biggest change from traditional advice, which often pushed heat.
Right.
Yeah, but cold is anti-inflammatory. It helps constrict blood vessels locally and reduce the swelling that's causing the compression. You can use ice wrapped in a thin cloth, a bag of frozen peas, or one of those gel packs designed for breasts.
So cold is the go-to now. And what about antibiotics at this stage?
Hold off. Since this stage is not typically an infection, there's a strong caution against using antibiotics. They won't help the inflammation.
Because there are no bacteria to kill yet, usually.
Exactly. And using them unnecessarily contributes to the huge public health problem of antibiotic resistance. Plus, it can disrupt the normal, healthy balance of bacteria in your breast.
Okay, so no antibiotics unless clear signs of infection develop later. The focus at stage 1 is responsive breastfeeding.
Absolutely. Feeding your baby on cue whenever they show hunger signs is the most effective and natural way to ensure milk is removed regularly. This helps your supply regulate to match your baby's actual demand, preventing that excessive fullness that kicked off the whole cycle.
Which leads to another crucial point, another shift from old advice. Avoid the urge to feed or pump excessively, trying to empty the breast completely.
Yes, this is a big one. Trying to pump or feed way beyond what your baby needs can actually be counterproductive.
You're telling your body to make even more milk.
Precisely. It signals your body to ramp up production, potentially leading to hyperlactation and oversupply. More milk means more volume, more potential pressure, and thus more inflammation risk. It can worsen the problem.
Okay. What else helps at this stage?
Take a moment to check your baby's positioning and latch, or attachment, at the breast. An effective, comfortable latch is really essential for the baby to remove milk efficiently.
If the latch is shallow or painful,
Then milk removal might be less effective overall, contributing to localized fullness and pressure.
changing feeding positions could help too.
It can. Different positions might put pressure on different areas or allow the baby's jaw to compress different milk ducts more effectively. Experimenting safely to find what feels best and maybe helps drain a specific tender spot can be useful.
And what about external things like bras?
Good point. Ensure any bra you wear is well-fitting and supportive, but definitely not tight or restrictive. Avoid underwires that dig in, tight clothing, even tight straps from heavy bags, or baby carriers that put constant pressure on breast tissue or under the arm where lymph nodes are. External compression can definitely add to the internal pressure problem.
Now, what about supplements? Sometimes you hear about lecithin.
Yeah, for people who experience frequent episodes, supplements like sunflower lecithin or soy lecithin are sometimes mentioned. The idea is they might help decrease milk viscosity, make it flow a bit easier.
Is the evidence strong?
The evidence is pretty mixed, honestly, not super strong. But it's an option people discuss. It's definitely something to research yourself and discuss with your healthcare provider. Now, if that initial inflammation isn't managed effectively, maybe the cause of the fullness continues or the compression on the ducts leads to significant milk backing up, what we call milk stasis.
And things can escalate.
Yes, the situation can progress. And this leads us into stage 2, mastitis.
Mastitis. That's the word that often brings more fear, isn't it? But it's not usually caused by just missing one feed, right?
Generally, no. It's more often linked to factors that lead to ongoing or worsening inflammation. Things like chronic engorgement, maybe consistently overpumping, or just that unresolved early inflammation can increase the risk.
So the inflammation hangs around and the milk isn't flowing well?
Right. That prolonged inflammation, combined with milk sitting static in those compressed ducts, creates a more favorable environment for bacteria to actually multiply. We all have bacteria normally present on our skin, even within the milk ducts in small, balanced numbers.
But when conditions change...
When the conditions are right, lots of static milk, inflamed tissue, that bacterial balance can get disrupted. Certain bacteria can overgrow, leading to an actual infection within the breast tissue itself.
Okay, infection. This brings up a really critical question, one that sometimes causes confusion. If you think you have mastitis, should you keep breastfeeding from that sore side?
The clear evidence-based recommendation is yes, continue breastfeeding from the affected breast if you can.
Why is that so important?
Because continuing to remove milk helps promote flow, which is crucial for reducing that milk stasis and relieving the pressure that's driving both the inflammation and contributing to the infection. Stopping feeding from that side can actually make the situation worse, potentially trapping bacteria and increasing the risk of developing a more severe complication, like an abscess.
And what about the baby? Is it safe for them? There's that myth.
That it's harmful or contagious, that's simply not true. Mastitis is an infection within your breast tissue. It's not contagious in a way that poses a risk to a healthy baby. In fact, your baby nursing effectively is part of the solution. It helps remove milk and reduce the inflammation. Continued responsive breastfeeding is beneficial for managing the mastitis and for maintaining your milk supply.
Okay, so if you suspect mastitis, you keep doing all those foundational steps from stage 1. Prioritize rest.
Absolutely essential. Continue using cold packs frequently on the affected area to keep reducing inflammation and swelling.
Check latch and positioning. Avoid tight clothes.
All still apply. But with mastitis, you typically feel much more unwell systemically. That's a key difference. It indicates a more significant inflammatory response, and an infection is now involved.
So the symptoms are more pronounced. That hard, sore lump might feel more defined or painful.
Yes, often. There's a general feeling of being quite sick, achy all over, really fatigued, run down. People often describe it as feeling like they have the flu.
That widespread feeling of illness is a big sign.
As a hallmark of mastitis compared to just that localized early inflammation.
And often a fever comes with it, maybe low grade initially.
Often, yes. You might also see more significant skin changes over the affected area.
Like a larger patch of redness or pinkness or, again, maybe brown or gray depending on skin tone.
Exactly.
It's fascinating how the body signals this stage with that systemic flu-like feeling. It's not just local anymore.
It really isn't. The body has definitely ramped up its defenses. So the specific management strategies for mastitis build on those earlier steps. Continuing rest is still paramount.
Keep using those cold packs often.
Definitely. Keep feeding your baby on cue from both breasts. Another technique that can be helpful for managing the engorgement and swelling in mastitis is gentle lymphatic drainage.
Okay, this isn't deep massage.
Absolutely not. It's very different. It involves using very light, flat fingertips to gently stroke the skin in the areas where lymphatic fluid naturally drains. Think particularly in the armpit area on the affected side, and maybe across the upper chest towards the collarbone.
So super light strokes, just moving the skin, aiming to help fluid move away.
Yes, you're gently encouraging the natural lymphatic flow to help clear excess fluid and inflammatory byproducts from the inflamed tissue, which can reduce swelling and pressure. It should feel comfortable, even soothing, definitely not painful or deep.
What about pain relief? Feeling flu-like and having breast pain sounds miserable.
It really can be. Discussing pain and inflammation relief with your healthcare provider is crucial. They'll likely recommend over-the-counter options. Alternating ibuprofen, which is an anti-inflammatory and helps with pain.
Like Advil or Motrin.
Right, and acetaminophen for pain and fever.
Like Tylenol.
Alternating those according to the package directions can be very effective at managing symptoms. And probiotics, taken by the mother,
Might help restore healthy bacteria.
there's some suggestion of that. It's definitely worth researching and discussing with your provider as a potential supportive measure, but it's not a primary treatment on its own.
Okay, so with all these strategies, how do you know when mastitis has crossed the line from something you can manage at home with rest, cold, feeding, and maybe pain relief to needing definite medical attention?
There are clear indicators for that. You need to call your doctor or healthcare provider if you don't start feeling any better, or especially if you feel worse, after about 24 to 48 hours of really diligently applying these strategies.
And the fever.
And if you develop a fever of 101 degrees Fahrenheit, that's 38.4 Celsius, or higher, that's a strong signal that a significant infection is likely taking hold and needs medical assessment.
So high fever or not improving means call the doctor promptly.
Absolutely. At this point, antibiotics are typically necessary and will likely be prescribed. It is absolutely vital that you take the full course, exactly as recommended by your doctor. Even if you start feeling significantly better after just a day or two, finish the entire prescription.
Why is finishing the course so important?
Stopping antibiotics early is a major reason why bacteria develop resistance. You might kill off the weaker bacteria quickly, but the tougher ones survive if you don't complete the course, leading to potential recurrence or harder to treat infections later.
Okay, take the full course, and while recovering,
Continue to rest as much as you possibly can. Stay really well hydrated.
and keep nursing if possible.
Yes, keep nursing if you can. If nursing on the affected side is just too painful or difficult temporarily, continue to gently hand express or pump just enough for comfort. If you absolutely cannot remove any milk from that side due to severe pain or swelling,
Then what?
focus on using ice packs frequently to reduce that inflammation and compression as much as possible until you are able to manage getting some milk flowing again.
Unfortunately, even with good care, in a small number of mastitis cases, things can progress even further. What happens then?
In a small percentage, mastitis can lead to stage 3, developing an abscess.
An abscess, that sounds more serious. What is it exactly?
It is more serious. An abscess is essentially the body's attempt to wall off a significant, uncontrolled infection. It creates a confined pocket within the breast tissue that contains pus.
How would that look or feel different from mastitis?
It typically feels like a very distinct, often somewhat round or oval area that is hard, it feels like there's fluid inside, and extremely tender or painful to the touch. Unlike the more diffuse tenderness or lumpiness of early inflammation or mastitis, an abscess usually feels like a more clearly defined, localized mass.
So more localized and intensely painful.
Often, yes. Sometimes the symptoms of mastitis might seem to get a bit better and then suddenly worsen significantly as the abscess forms and collects pus. Other times, the pain and swelling just steadily intensify until the abscess becomes undeniable.
Can it resolve on its own?
It almost always requires medical drainage. This is definitely not something you can manage at home.
So medical intervention is needed. Who performs the drainage and how?
It's a procedure done by a physician, usually guided by ultrasound, to pinpoint the abscess accurately.
And what do they do?
There are a few main methods. One common approach is needle aspiration. Using the ultrasound for guidance, they insert a needle directly into the abscess cavity and draw out the pus.
Does that get it all out?
It often needs to be repeated several times, maybe over a few days or appointments, to fully drain the pocket as it refills.
Are there other options?
Yes. Another method is inserting a small drain, like a thin tube, that stays in place for a few days. This allows the pus to drain out continuously until the abscess cavity collapses and starts to heal. There's some discussion among experts about whether a drain should be placed right at the first aspiration or only if repeat aspirations are needed.
And sometimes surgery?
In more complex cases, or if aspiration isn't fully successful, surgery under anesthesia might be necessary to open the abscess widely and ensure it's completely drained and cleaned out.
If you have an abscess, antibiotics are a given, right?
Absolutely. Antibiotics will always be prescribed alongside the drainage procedure to treat the underlying bacterial infection that caused the abscess in the first place.
Now, here's a question. With something as serious as an abscess needing drainage and antibiotics, what about breastfeeding?
Even with an abscess, continuing to breastfeed or express milk from the affected breast, if you are able to tolerate it comfortably, is still considered valuable.
Really? Why?
Because removing milk continues to help decrease inflammation in the surrounding breast tissue, promotes drainage, and supports overall healing. Of course, you need to follow your medical team's advice, but stopping milk removal entirely isn't necessarily the goal unless advised for a specific reason.
Wow. If mastitis does keep coming back, what should someone do?
If you experience recurrent mastitis, This is a really important point to discuss with your healthcare provider. Ask about the possibility of getting a milk culture and sensitivity test done.
A milk culture. What does that involve?
They would take a sample of your milk, collected carefully from the affected breast, and send it to a laboratory. The lab technicians then try to grow and identify the specific type of bacteria causing the infection.
And the sensitivity part.
Once they identify the organism, they test various antibiotics against it in the lab to see which ones are most effective at actually killing that specific bug.
Wow, that sounds incredibly useful. It ensures you get the right antibiotic for that specific infection.
It is. It allows for targeted therapy rather than just using a broad-spectrum antibiotic that might or might not be the best choice. And this connects directly back to that huge issue of antibiotic resistance we mentioned.
Right. Okay, let's make this super practical. What should people absolutely not do if they feel that tender spot, that lump or suspect mastitis is starting? First one seems to be heat.
Yes. Applying heat to the breast using warm compresses, soaking in a hot bath or shower directed at the breast is now discouraged. Heat increases blood flow and vasodilation, which can actually increase the inflammatory response and worsen the swelling.
So it does the opposite of what you want.
Exactly. This is probably the single biggest reversal of common past advice.
Okay, what about trying to physically work out a blockage, like deep massage?
Avoid vigorous, deep massage or aggressively squeezing the breast tissue trying to get rid of what feels like a clog. This can cause more tissue trauma, increase inflammation locally, and it doesn't really address the root problem, which is usually that swelling compressing the ducts from the outside.
So gentle lymphatic drainage is okay, but not deep forceful massage.
Correct. Gentle lymphatic drainage supports fluid movement away from the area. Deep massage can add injury to insult.
What about some of those more creative methods people used to suggest?
Yeah, the dangle feeding position.
Yeah.
While maybe well-intentioned, it's awkward, often uncomfortable for both parent and baby, and generally ineffective at resolving the underlying issue of inflammation and ductal compression. It doesn't tackle the core physiology.
Using tools. I've heard of people using combs or even electric toothbrushes or vibrators on the breast.
Ooh, yeah. Similar to the vigorous massage issue, applying these kinds of tools, especially with pressure, can cause tissue damage, bruising, and potentially increase inflammation. They are definitely not supported or recommended treatments and could easily do more harm than good.
And let's hit this one again because it seems counterintuitive but is so important. Trying to empty the breast completely through lots of extra pumping or forcing extra feeds.
Yes. As we discussed, aggressively trying to empty the breast signals your body to make more milk, potentially leading to or worsening hyperlactation. More milk volume equals more potential pressure, which can worsen the very inflammation and flow restriction you're trying to solve.
Focus on comfort and adequate removal for the baby's needs, not drainage.
Exactly. What about antibiotics right at the start? That first hint of tenderness.
Definitely avoid this unless you have those clear signs of infection. We talked about the high fever, 101 degrees or higher, or symptoms getting significantly worse after 24, 48 hours of trying rest and cold. Using antibiotics prematurely for what is just inflammation disrupts your body's beneficial bacteria and contributes to the critical problem of antibiotic resistance.
Right. And finally, what about applying things topically? Saline soaks, olive oil, castor oil, other things on the skin or nipple.
These are not evidence-based treatments for addressing the internal process of inflammation or potential infection within the breast tissue itself. They won't help the underlying condition and could potentially cause other issues like skin irritation, allergic reactions, or blocking pores. The focus needs to be on those internal management strategies.
Exactly. By focusing on reducing inflammation, supporting your body's natural processes for milk flow, being mindful of triggers like excessive fullness or external compression, you're just much better equipped to manage these common challenges effectively and hopefully reduce the risk of them progressing or coming back again.
How can applying this kind of process-oriented thinking, really digging into the why behind symptoms, understanding how the body is reacting physiologically, and trying to identify the root cause, how can that empower us? Not just in navigating this specific health challenge, but maybe in making more informed decisions about other complex health information we encounter in our lives.
It's definitely something to consider as you move forward thinking about health in a more connected way.